Okay, great. So go ahead and tell me about your knees. Like why did you come in here?
So 1980 something, right before I started going to college, I ripped up all the cartilage in my knee, and it's been bone on bone ever since. And it never really came back to where I didn't have pain with it.
Oh.
I had it scoped out in the late 90s, and although they got rid of some of the noise that was in there, the pain never went away. So it's been 20 plus years of pain in my knees. And I talked to doctors about doing a total knee replacement, but the thing about that was they told me how it's done, the rehab that's involved, and the fact that it's kind of like a parking lot after 20 years, and that concrete in there kind of starts breaking up. So maybe 15, 20 years is the best you're going to get on a knee. And I was just waiting for something like stem cells to come along that would grow some cartilage back and not have to go through that type of rehab.
Right, that makes sense. Have you done any treatment for your knee so far? Before this?
Nothing before this, other than having the shreds scoped out of it.
Okay. And then how many injections did you get on each knee?
For the stem cell, just one in each knee. And the pain went away immediately. And I know that's not supposed to happen. So I thought the topical that they put on was going to numb the knee, and they ended up giving me lidocaine to start with before they did the actual injection. And I thought maybe that was the reason the pain went away. And I didn't know how long lidocaine lasted. I thought, well, maybe that lasts a week. But I understand it only lasts a couple, 3 hours. And after that, there was still no pain anyway. So I assume that the stem cells worked, or I'm just very easily, susceptible to the idea that it could work. And I don't think that's the case.
When did you get your injection?
So it's been almost a week, right? 10 days almost.
Yeah.
And still no pain. So I'm coming back in on Thursday for a follow-up. It's a miracle. I mean, it's incredible to be able to wake up and stand up and not feel like you have to do special stretches just to be able to walk down the hall. There's no pain. It's great.
That's great. Is there anything else that you've done that you noticed you can do better now?
Well, they told me not to do anything too strenuous for the next, month to 2 months. So I haven't really been pushing anything too hard. But just, walking up the stairs without pain is pretty nice. So I'm looking forward to getting back into working out again. I was working out and doing the treadmill prior to the injections, but I wore braces to do that, and it was a constant awareness of the pain that was there. But you can't not stay active. But now I'm really looking forward to getting back and seeing how far I can push myself.
Great. Well, that's great.